In our society today, nourishing diets and regular exercise are often encouraged to maintain a healthy lifestyle. We often hear that it is unhealthy to be overweight, but just why exactly is that? How can we study the effects of diet and exercise on our bodies? At the University of British Columbia, Dr. Kristen Campbell is a researcher who takes great interest in the relationship between health and exercise. Along with other scientists, she devised an experiment that will help future researchers have a better understanding of the effects of exercise as well as diet on cancer prevention. The story of how Dr. Campbell got interested in this area of research is quite fascinating.
I started doing research on exercise and cancer I was always very interested in sports. I played sports all the time when I was in high school and before that. And so when I was in 4th year of my undergrad program in physiotherapy, I had to pick a thesis topic. And I really wanted to do something that was women's health and exercise combined, or physical therapy combined. And so there was some research that exercise might reduce your risk of breast cancer or other cancers related to estrogen levels. And so I thought, oh, I really would be interested in looking at that topic. And that was 4th year undergrad, and here I am now.
Dr. Campbell goes on to explain the main purpose and goals of her research.
So the research question we wanted to look at was, why is exercise protective for lowering the risk of postmenopausal breast cancer? That was the main reason we started doing this research. There is a lot of evidence to suggest that in observational studies, so when they ask people, how active were you, if they do that at the population level, women that were more active have a lower risk of getting postmenopausal breast cancer.
To conduct the research, blood and tissue samples were collected from women before and after the study. The women were then separated into 4 groups: the control group, the calorie-restricted diet group, the exercise group, and the diet and exercise group.
When we did this analysis, we didn't see any difference between those groups because there was a very small number in each group. When we did see, though, is that we saw changes by how much weight loss they had. So no matter what group they were randomized to, those that lost more weight, we saw bigger changes in gene expression at the level of the fat tissue.
We noticed that the subjects in the study were all postmenopausal women, and we asked Dr. Campbell how the study would relate to middle-aged men.
I think that it's 1 in 100,000 incident rate for men, and it's 96 in 100,000 for women. So it's very rare. So it's very hard to study male breast cancer because the cases are very rare. That being said, exercise and weight loss and a healthy body weight is linked to a decreased risk of other cancers like colon cancer that affect both men and women.
As many of our friends and loved ones begin to reach their middle ages, it is important for them to maintain a healthy body weight. Dr. Campbell stresses the importance of diets low in trans fats with lots of fruits and vegetables and whole grains, as well as regular physical activity. Doing so will not only decrease the risk of cancer, but many other associated diseases as well.